Hi, Dr. Sasse here from Sasse Surgical in Reno, Nevada. A number of people have asked about this intersection between obesity and COVID and whether I should get my surgery or whether it's going to reduce my risks for COVID. And although we all hope that COVID is starting to turn the corner and as more vaccinations roll out, we will see the numbers decline rapidly as we're already seeing. Most experts think that this is something that's not just going to be completely in the rearview mirror. We think that the variants may play a role. There will still be a significant unvaccinated population due in part to individual preference and in part possibly due to supply. But for whatever reasons, and just like the influenza virus mutates, we've already seen mutations of the COVID virus, it's likely that this will continue to surface in some way, shape, or form. So it still makes sense to pay a little bit of attention to the risk factors and the best strategy moving forward if you or someone you love is battling morbid obesity and concerned about the intersection with COVID. So let's start with a couple of pretty alarming facts about it. A recent study looked at all of the people in the United States who were hospitalized for COVID and found that a whopping 78% of them were obese. This is proven to be the number one risk factor for getting severe illness and mortality related to COVID. And so our thought has been, and this has been true all during the COVID epidemic and crisis, has been to act as soon as feasible and possible to reduce that risk by moving forward with metabolic surgery at the safest possible opportunity. As far as we know, the practices in our hospital and centers, like it all around the country, have been very effective at avoiding any in-hospital transmission. The units are separate, the sterility precautions, the personal protective gear, etc. have been off the charts effective. As far as we know, there has not been transmission to people having elective surgery, and I still believe that to be the case. So we have been continuing to help people with their metabolic surgery needs all during the COVID crisis for the most part. And now I see many people who are coming to see me in follow-up of 6, 9, 12 months who have lost tremendous amount of weight and who, moving forward, clearly now have a much reduced risk should COVID still come. They will be in much better position, especially in terms of their pulmonary mechanics and their risks of having a respiratory event. But it goes much beyond that because we know that obesity also translates into what is called this high inflammatory state. We have many circulating proteins and cytokines that cause our body to be in a pro-inflammatory state. And that is just the sort of state of high inflammation that COVID takes advantage of. It's one of the reasons we think that people with obesity get such severe lung infections and such severe immune reactions to the infection in the lungs that fill up with fluid and lead to respiratory failure, as well as other organ injury across the whole spectrum, across the body. So by reducing that body weight, not only does a person have improved pulmonary mechanics, meaning we just can breathe easier because we have less weight, but we have also markedly reduced that pro-inflammatory state and reduced the risk of COVID and many, many other conditions that come along the way in life by being at a lowered, reduced, healthier body weight and inflammatory state. So our view has been, even though some people are justifiably concerned about moving forward with elective surgery, possibly concerned about exposure, going through a surgical process. Certainly now that the numbers in hospitals in our region and around the country are so far down, we've been very fortunate to have almost no patients remaining in the hospital at this time compared to when they were just full of COVID patients months ago. It is certainly a far lower risk to move forward with metabolic surgery now and reduce that long-term risk going forward. While there are risk reductions across the board in terms of heart disease, lung disease, kidney disease, diabetes, etc., there are specific risk reductions with respect to possible COVID infection, which unfortunately I don't think is ever going to be completely gone. I hope I'm wrong, but I don't think it's ever going to be completely gone. So I hope that helps kind of stratify those risks of what you should be thinking and advising your loved ones with respect to the risks of moving forward with metabolic surgery in this new era of possible ongoing low-level COVID disease. All right, I hope that's helpful, and I wish you the very best of health.